Bismillahirrahmanirrahim. Assalamu alaikum. Hi everyone. Today I am going to start from a scenario. A 64-year-old diabetic woman presents to general practitioner with acutely painful, swollen and hard knee joint. There is limited range of movement and movements are painful in all directions. There is no history of trauma. She has temperature of 98 degree Fahrenheit. What is the single most likely diagnosis? Explain. Options are reactive arthritis, bursitis, rheumatoid arthritis, and septic arthritis. Answer is septic arthritis. Is the patient presented with classic features of septic arthritis? Diabetes mellitus is a risk factor for septic arthritis. In a patient presents with acute monoarthritis, septic arthritis is the most common diagnosis to exclude, as if not treated will result in permanent damage and even death in some patients. So today I would like to talk in detail about septic arthritis. First, you should know what is septic arthritis. It is infection of any kind in body finding its way to giant space. Septic arthritis is relatively rare in an undamaged giant. Risk of infection is directly proportional to the degree of giant damage. Risk factors which predisposes to septic arthritis include pre-existing giant disease like osteoarthritis. It provides a slight risk. Rheumatoid arthritis have a greater risk because of greater destruction. The greatest risk is with a prosthetic giant. Other risk factors include diabetes mellitus, immunosuppression, chronic kidney disease, recent giant surgery, IV drug abuse, and age more than 80 years. Now, how a patient of septic arthritis present. Patient presented with acutely inflamed joint. The joint is warm, red, immobile, and often has a palpable effusion. Chills and fever is present in case of bacteremia. Always consider septic arthritis in an acutely inflamed joint, as it can destroy a joint within 24 hours. Most common giant affected is knee joint. It is affected in more than 50% cases. Ask yourself, how did the organism get there? Is there any immunocompromised state, giant disease, diabetes mellitus, or any focus of infection like IV lines, infected skin, or pneumonia? Move on to the etiologies of septic arthritis. In 40% cases, the cause is staphylococci. In 30% cases, etiology is streptococci, while in 20% cases, gram-negative rods are responsible. Now, how to investigate a case of septic arthritis? Urgent giant fluid aspiration for microscopy and culture sensitivity are the key investigations. Giant fluid shows more than 50,000 cells, predominantly neutrophils. Sensitivity of giant fluid culture is 70 to 90%. Plain X-ray and CRP may be normal. Gram stain is another important investigation, while blood culture is sensitive in 50% cases. Now, if a suspected or diagnosed case of septic arthritis presented to you, how will you treat the patient? Start an adult patient empirically on 1 gram ceftriaxone in BD and 1 gram vancomycin in BD. Give accurate antimicrobial therapy according to culture sensitivity report. IV antibiotics should be given for 2 weeks, then switch to oral antibiotics and give it for 2 to 4 weeks. Ask for orthopedic advice for consideration of arthrocentesis, lavage, and debridement, especially if there is prosthetic joint involved. Give NSAIDs like celecoxib 200 mg in BD for pain with PPI cover. This was all about septic arthritis.